Selecting a health insurance plan is overwhelming, whether it's for yourself or your family, whether it's on your own or through your employer. These policies can be intimidating. This morning, our daytime doc, Dr. Tom Rogers, talks to a special guest about some of the things that you might want to consider when choosing a plan that works for you.
Thank you. I want to have a conversation today with you about health insurance. And I want to talk to you with Ben Rogers, who runs my practice for many years and has a lot of experience with medical management and as well as insurance companies and where healthcare is going. But you know, we've seen a lot of recent changes. The new election will probably bring about even more changes. There's been a lot of concern in the last few years about the Affordable Care Act and how it's affecting premiums and deductibles, which they have exploded in an upward fashion. So, you know, the focus of my practice for the last 10 years has been on not taking medical insurance. I'm probably one of the very few doctors in this country who hasn't taken a health insurance in 10 years. And for me, it's worked out great. It's enabled me to really focus on the patient and not worry about figuring out a code to get more money from the insurance companies or running an unnecessary test. So it's worked out really well. I think I've become a better doctor because of that. But I want Ben to discuss with you today some of the things that you should maybe think about when you are getting an insurance, what you should expect from it. Ben, what's going on with health insurance?
Well, what we're seeing is a high deductible plan become more and more common. So that means that your healthcare dollars you have to be a little bit more intentional about. And the great thing about a high deductible plan is that you have the option to have a medical savings account. And that's really what we're encouraging everybody to get, because it's tax deductible going in and tax-free money coming out. So, you know, as we're going towards this high deductible, take care of yourself sort of healthcare environment, you have to really take control of all of your healthcare stuff. And that means looking at your health insurance card and calling and asking your insurance carrier what is covered, you know, what exactly you can do in a given year, where you can go, what for, that sort of thing. And I don't think many people do that. I know before I got into this that I didn't. But now you look at your card, call them up, and see what's covered, and understand what you can and cannot do through your insurance. And for everything else, I think you use a health savings account for.
You know, I'm not sure what's going to happen with the Affordable Care Act, whether it be repealed or made better. I know a couple things that it's really helped, and one of them is that it took away pre-existing, which I think is good. Another one, it covers screening. What type of patients do you think should really stay on a low deductible plan?
If it's an employer plan and it's, you know, a lower deductible, then that's great. You know,
somebody with maybe a chronic illness or
Sure.
that uses a lot of medications, but
Sure.
maybe for your average patient that's fairly healthy, they should go with a higher deductible because it's cheaper on them.
It's going to be cheaper monthly, and again, you want to use insurance for what it's for, and that's really to keep you out of bankruptcy.
I've always thought that insurance was really not for every cold and sniffle you got, but actually for catastrophe like
Right.
surgery, hospitalizations, and
Right.
all that. But it's really interesting what's going to happen. And I want people to know that at Performance Medicine, we will help you decide what you need to do. That we're here for you. I have no incentive otherwise to do anything other than help you. If questions, please contact us at one of our offices or look up performancemedicine.net.